All right, so good afternoon and welcome to Being an Effective Spokesperson as a Health Professional. My name is Becca Bolas and I'm the Executive Director of the Maine Public Health Association, and we're so thrilled that you're able to join us today. The goal of MPHA's webinar series is to feature and promote ongoing public health work in Maine, including accomplishments, current events, programs, skills and professional development opportunities, and other resources. If you're interested in being featured in one of our webinars, please let me know. We would love to have you. Shortly, I will turn it over to Matt Wellington, who is the Public Health Campaigns Director for US PIRG, a national consumer advocacy group. If you have questions during the presentation, you may use the chat feature by clicking on the call-out bubble in the gray footer on your screen. I will try to moderate the chat box as best I can, but in the interest of time, we may have to respond to questions after the presentation. So I want to thank you very much for joining us today, and I'll turn it over to Matt.
Thanks, Becca, and thanks everybody for joining today's webinar. As Becca said, I'm the Public Health Campaigns Director for US PIRG, the Public Interest Research Group. And some quick background on me. So I have been working on public health issues mainly from an advocacy and organizing standpoint for about 7 years now. And PIRG is a consumer advocacy group that's been around for a long time, and our biggest strength is that we've honed the ability to get our message out to the public and to decision makers through media, through social media. We've engaged stakeholders on the issues that we work on all over the country, and so we've honed this craft of organizing and communications over the last 40 years, and I'm really happy and excited to be able to pass on some of that knowledge to folks on the webinar when it comes to how to be an effective spokesperson as a health professional. And my key issues that I work on, just to give the context on that, because I'll refer to them throughout this presentation in my examples. Primarily right now, we're really focused on addressing antibiotic overuse in agriculture. I think folks probably know that there's a major public health threat because antibiotics are not working as well as they used to. Bacteria are resistant to the drugs, and I think the single biggest factor that contributes to antibiotic resistance is overuse. And it turns out that most of the medically important antibiotics that are sold in the United States actually go to meat production, not necessarily to treating people. So we've been working over the last several years to reduce antibiotic use on farms and specifically make sure that the drugs are only used to treat sick animals rather than how they're primarily used now, which is to compensate for industrial farming conditions. So that's the context on a lot of the examples that I'll be giving here. And from that work over the last several years on antibiotic resistance, I've built up a group of physicians and other health professionals across the United States who are really passionate people that want to, of course, keep antibiotics effective for the future so that they can continue to treat their patients. And they work directly with me to get the skills that they feel they need to be able to effectively speak about this issue to the media, to the public at large, and to decision makers. So I run a group called the Health Professional Action Network, and that is the central forum for how we train physicians and other health professionals on advocacy skills like this. And I also recently took on another group called the Clinician Champions for Comprehensive Antibiotic Stewardship Collaborative, which is similar in purpose and mission. So that's the background on me and some of the work that I do to kind of lay the groundwork for the rest of the webinar. So what I'm hoping folks will accomplish from today's webinar is a basic understanding of how media operates and really how to use your kind of pulpit as a health professional in the most effective way you can to get your message out there to the public and to decision makers on whatever issues that you're working on. So a lot of the examples I'll give will be from my work on antibiotic resistance, but the principles and the skills that I'll talk about you can really easily apply to any issue that you're trying to address as a health professional. So why focus on media? I think first off, folks probably know the saying about the tree falling in the woods. I never remember the actual saying, but the basic message is if you are doing something incredible and you're making a difference or trying to make a difference, but people don't know about it, it's just a massive missed opportunity. And media is one of the best ways that you can engage the public and educate them and get your message out there to thousands or hundreds of thousands or even millions of people at the same time. And that helps you not only build your visibility, but it also establishes legitimacy around an issue. So I think one great example of this is the e-cigarette problem that we're seeing now among youth. I mean, that has been in the media more and more, I think, every day over the last couple of years. And from that media attention, it is now part of the public's consciousness, right? People see it as a major issue that they are paying attention to at, maybe different levels depending on who they are, but people know what it is. People know it's a legitimate public health issue that folks are talking about. Credibility is also a big part of media work. So if you are printed in an opinion editorial in the Portland Press Herald or in a national paper, it helps build your credibility as a trusted source on the issue that you're working on, and that will certainly help you get even more attention in the future. Hey, if anybody's on who's not on mute, please go on mute because we're hearing a little bit of background noise. And then, of course, as I mentioned, you educate decision makers, elected officials especially. They pay very close attention to what is being talked about in the media, especially in their hometown papers and the outlets that are covering their district. So it's a great way to educate decision makers and, of course, the public at large. So health professionals as spokespeople, I've had the real pleasure of working with physicians and other health professionals for the last several years, as I said. And, I think as much as possible, even though I know the ins and outs of antibiotic resistance and I'm the advocate working on our campaigns in that field, I want the physician, I want the infectious disease specialist to be the one in front of the TV camera or the one speaking to the newspaper reporter, because they will have, the compelling personal stories to convey to the reporters, which is one of the best ways to tell character-driven stories to the media. And one of the things that I hear from reporters all the time in my own work is that they want character-driven stories. It's not supposed to just be about the facts. They want to be telling the story of how this might affect their readers or their viewers directly. And so I think health professionals, when it comes to health issues, whatever it is, are one of the best people to be able to actually convey those stories in character-driven narratives. And of course, your credible sources. So, again, me, even though I know the ins and outs of antibiotic resistance, it's much more credible to have a physician in front of the TV camera with the stethoscope and the white coat, and people understand, okay, she is an infectious disease expert. We should be listening to what she's saying. And lastly, I think it's always important to note that medical professionals, health professionals are consistently rated in the top 5 most trusted professions to the public. People listen to what health professionals have to say, of course, obviously, especially when it comes to health issues. So that is just the case for why health professionals should be effective spokespeople to the media, and you should be taking every opportunity you can to be lending your expertise and your personal stories to the issues that you care about in the media. Oh, and this is one of our physicians that I work with pretty often. His name's Sujit Sushandran. He just moved to Georgia, but he used to be based in Massachusetts, and he's done a ton of work with us in the media, including TV interviews and opinion editorials, you name it. So some principles for media. I think number one is making it newsworthy. And what I mean by this is a couple things. So you can create your own news is the number one thing that you can do. That sometimes can be a bit harder, but you always want to be thinking through what are people thinking about? What are people talking about? How can I put my message out there to reporters in a way that will immediately click for them as, okay, yes, this is something that will resonate with our readers or our viewers, and it's news, right? So again, with the e-cigarettes issue that's up there right now in the media, it's a perfect example. Every day it seems like there is a new headline about some new health discovery from e-cigarettes that's happening, or the mysterious lung disease that's associated with vaping now. Every day it seems like the numbers of the folks affected by that are growing, and so the media keeps writing about it because it's new. There's something new. So I think the topic itself it's a hot topic in the media, but really the reason it keeps getting coverage is because there's constantly new information coming out. So that's making something newsworthy, right? And then the second piece of how to make something newsworthy is taking what's already in the news and what's happening and working your message into that. And so an example I have of this is last year I was working with a physician, Dr. Patel, in Michigan, and we were trying to place an opinion editorial in the state, I think it was the Lansing State Journal, which is the capital newspaper in Michigan, about antibiotic overuse on farms. And I reached out to the editor of the paper, and I pitched them on taking the op-ed, and his feedback was, this just is not, really local. It's not what we would want to be printing in the state journal. And so I went back to Dr. Patel and I said, we need to figure out a way to, take what our piece is saying and make it much more relevant. We need to find something that's already happening in the state and put two and two together. And it just so happened that she had a really close relationship with somebody who worked at the Department of Public Health in Michigan. She was able to get new information on an infectious disease outbreak that was currently happening in the state, and there were cases of people coming down with pretty severe drug-resistant infections in the area around where the paper circulated. And so we really quickly revised the piece to include that, submitted it back to the editor, and they immediately printed it. So again, for making things newsworthy, there's a couple big ways to do it. I think one is creating your own news, but always keeping in mind, what is the new information that you're putting out there to reporters and to the public? And then secondly, what's already happening that you can use to get your message out there in a newsworthy way? The second big principle, and I think this is especially important for folks who have medical backgrounds, is to remember your audience. When you are reaching out to papers or TV stations, most of the time your audience is going to be the general public. And I've had a lot of experiences working with medical professionals where we're co-authoring a piece that we're going to send to the media. And when I send them the opinion editorial or whatever it is, and they send it back to me with their edits, it kind of looks like something that would be printed in a medical journal. And that is fine, but again, we need to remember our audience. And most of the time with media, it's the general public. So always keep that in mind. I think for me, when I talk about antibiotic resistance in media settings, I always come back to, what would my mom think about this? She's a math teacher. She doesn't know the ins and outs of antibiotic resistance necessarily, but is the message I'm putting out there something that she will read or hear on the TV or the radio and immediately understand what's happening and why it's a problem? And, will it get her heart pumping and her head nodding? And that's the kind of thing you want to think through when I say remember your audience. And this could also be, a little bit different depending on the outlet. I think most of the time your audience is going to be the general public, but sometimes it will be folks who have a medical background. And so one example of this is a publication called Stat News. It's the health affiliate of the Boston Globe. And that media outlet is much more catered towards folks who are in the health field. And so when I'm speaking to a reporter from Stat News or submitting something there for publication, my tone and the kinds of messages that I'm putting out there are slightly different. And then lastly, the big principle for media, the third one here, is stay on message. So sometimes reporters will have their own agenda for stories that they want to be putting out there, and it is really important that you don't take the bait, right? I think I've had this experience a bunch of times where I know the message that I want to get out to this reporter, but it becomes super clear pretty fast that as they're asking me questions, they're digging into one area or another that I just don't want to get into, because even though it might be something important, it's not the main message that I want to be putting out there to the public. So don't be afraid if you're doing a TV interview or a radio interview or whatever. Don't be afraid to act a little bit like a politician and not necessarily answer the specific question that they're asking you, but instead pivot back to your main point, right? Remember that you are doing media work to get your message out there, depending on your purpose for doing this. But most often, you want to make sure your message is up front and center. So always stay on message. And just really quickly to go through some of the types of media, I think folks probably are familiar with these just from your day-to-day experience. But TV, of course, is still one of the #1 ways that people get the news. I know that's the case in Maine. I think it probably varies throughout the country, but TV is still one of the primary sources for news media, even though I think folks are saying that it's probably migrating much more online. Newspapers, of course, things have changed a little bit in the newspaper world. There's the print sources, but the online sources tend to have much more reach and are much more flexible with the kinds of stories that they're able to publish and the timeline for doing so. And so now we're, because of online news sources, we're in a time where we have a 24-hour news cycle, right? I mean, it's not uncommon for a story to break at 9 o'clock at night, and then reporters are writing about it and publishing stories online almost immediately. So all that to say, you just have to really be, I think, a student of the media is what we call it now, where just make sure you're following the news, especially issues that you're trying to weigh in on. One of the best things you can do for this is set up Google Alerts. If you have Google, it's pretty easy to do. You set up Google Alerts. Like for me, I have Google Alerts on antibiotics, antibiotic resistance, e-cigarettes, which is the other issue I work on. And so every day I get a report in my email of news stories on those issues. One of the best things you can do to track the different media stories happening on the issues you care about. And then, of course, there are news sources of media. So Thrillist is an online publication. Wired is an online magazine. I think it might also have a print version, but primarily online, and then BuzzFeed. So think outside of the box in your media outreach. Don't just stick with the TV and the newspapers, because there is much more out there that you can get coverage in and still reach thousands of people and potentially an audience you wouldn't necessarily have reached. So just be creative and always keep your eyes open for those new kinds of media sources that are out there. And then, of course, blogs are also something that is increasingly getting media attention now. One example here is Food Tank is a food-related blog that has pretty good reach. So yeah, this is just the very quick overview of types of media. And again, things are changing in the media world. Be a student of the media, set up your Google alerts, and think outside of the box when you're trying to get coverage. So I want to give a quick example of a story that we actually just put out last week. US PIRG and a coalition of health and consumer advocacy groups. Every year we put out what's called the Chain Reaction Scorecard. This is a report that grades the top fast food companies on antibiotic use policies for the meat that they source. And this is the 5th year that we put it out. Every year it generates a good amount of media attention. This is an example of creating news. So when I talked about making your stories newsworthy, this is the first part of that. We were actually putting something out there that we knew would be newsworthy because it's new information. We're grading restaurants. It's really it's an incredible way to relate kind of a complicated issue directly to consumers, because people know McDonald's, they know Wendy's, they know these fast food companies, and so reporters understood, I think, that this was something that would resonate with their readers. This is something that people experience in their everyday lives, and a way for us to get our message out there about antibiotic overuse on farms in a way that would, people would actually understand it and immediately grasp it. So I just want to show a couple of the stories, and I'm going to X out. So this is from NBC News that ran last week. It's a pretty good story about the report. One thing I want to point out is the quote here. So my quote is really simple. So again, remember your audience. Overuse of antibiotics in the beef industry threatens our health, and fast food companies need to do more. So I could have said a lot more, and in most cases I want to say a lot more, but again, remember your audience. For me, this is the general public that I'm trying to educate about this issue, and so keeping it simple is really important. One other thing I wanted to note about this story, I think when it comes to getting media, one of the most important things to keep in mind is building relationships with reporters. So I think we probably have a pretty good variety of people on this call and the kinds of positions that you're in. If you're somebody who is actively trying to get media attention on an issue, you really need to focus on building your relationship with the reporters that matter. And so for this, I happened to be in New York City a few weeks ago, and I reached out to the medical unit at NBC asking if they would be open to a meeting with me to talk about some of the stories that we had coming up. And kind of surprisingly to me, they said yes almost immediately. And so I met with the entire medical unit, and that's how this story came about. So I think part of it was because we had a really good newsworthy story, but another big part of it was that I just made the point of trying to build my relationship with the reporters at the medical unit for NBC, and it paid off. And I think that's going to hopefully end up with us getting a lot more media coverage from them in the future. So some ways to build your relationships with reporters, again, don't be afraid just to reach out to them and meet with them. I think in my experience, reporters are actually pretty open to doing that. Even if you don't have like the juiciest news story at that moment to share with them, just reach out and try to grab coffee with them and get to know them and the kinds of stories that they're looking for, and you can share some of the things you're working on. And then, of course, and I'm not going to go into this much in this training, but Twitter is a fantastic way to build a relationship with reporters. If you have a Twitter profile, definitely follow all of the key reporters that are covering your issues. Retweet their tweets, tweet their articles as they come out, and weigh in on them. Say, great article by so-and-so, and tag them. It's a good way to build a relationship online with them, because Twitter is kind of like the online place that reporters live nowadays. So the other article that I wanted to mention here for Chain Reaction, this is one that was in Livestrong.com, and the reporter had asked me if we had an infectious disease expert who could speak about this, and so I referred her to Dr. Samir Patel. He's the Director of Antibiotic Stewardship at Lurie Children's Hospital. He gave her a quote, and you can read it really quickly here. So antibiotic resistance is one of the greatest public health threats we face locally and globally. We commonly see patients become ill or die from antibiotic-resistant infections. It's an increasingly common occurrence across all parts of our healthcare system, from community clinics to cancer wards. So the thing that I think is incredible about this quote is that first off, it's simple. So Samir's making sure that he remembers his audience, and he's relating it in a way that is personal to him. So he's experienced this. He's seen patients become ill or die from antibiotic-resistant infections. And I think again, thinking through, like, what would somebody who has no background whatsoever in antibiotic resistance think if they read this? I'm pretty sure if somebody read this, they would immediately grasp that, okay, this is a big problem. It has real-world implications for me. And then, of course, after his quote, which I think this is probably something he gave to the reporter as examples of things that might become antibiotic resistant, urinary tract infections, pneumonia. Again, those are things people know and they've probably experienced, and so it clicks for people in their minds that, okay, this is a problem I should pay attention to. So the next example I want to give has to do with interviews and actually speaking to the media. So I'm going to show a really short clip. This is not an actual TV interview, but we interviewed Dr. Cheryl Henderson from Wisconsin. She's an infectious disease expert there. And we put this video out on social media. It had thousands of views, which was great. But I think that Dr. Henderson just did a really good job of what I would consider a solid interview. So she remembers her audience. We had talked about how we want to put this out on social media and educate the general public. She's really conversational, and again, I think keeping in mind, would people without a background in antibiotic resistance immediately understand this? So I'm going to play this really quick. We're probably not going to watch the whole thing for the interest of time, but just to give you an idea of what I think a solid interview is and point out some of the highlights.
I'm Dr. Cheryl Henderson. I am a pediatric infectious disease specialist here at the University of Wisconsin School of Medicine and Public Health. I am the medical director of the Pediatric Antimicrobial Stewardship Program at the American Family Children's Hospital here at the University of Wisconsin Hospitals. We should be very concerned about antibiotic-resistant bacteria. Antibiotic resistance refers to the point when bacteria are no longer killed by the antibiotics that should kill them. This can occur when bacteria are exposed to antibiotics over a period of time, sometimes a short period of time, and the antibiotics are just no longer effective. We are seeing more and more bacteria become resistant. We can get to the point that we've heard of a superbug, that there are bacteria that we have very limited choices on what to treat them with, and there may be even no choices overall. As an infectious disease specialist, I am often called in to answer the question of how to treat resistant bacteria. And I have even seen babies and children become very seriously ill and even die of resistant bacteria. So yes, it is something to be very concerned about. There is an overuse of antibiotics in general, healthcare, in the meat industry. One thing that many people don't know is that most of the antibiotics in this country are used in food-producing animals rather than humans. So animals receive antibiotics on a daily basis. That means that their bacteria is exposed to antibiotics on a regular basis. And this would drive antibiotic-resistant bacteria. This bacteria can get into the environment and infect humans, get into the soil, into the water. It is possible for the farm industry to produce antibiotic-free meat. Here at the University of Wisconsin Hospital, in the past year, we've taken the lead in trying to reduce antibiotic use and exposure in our patients' families and employees. The kitchen here only serves now antibiotic-free meats.
Okay, so some of the things I want to point out from that interview, first is just the visuals. So folks might have noticed that she's wearing a white coat, and I know I've worked with physicians and other health professionals who are kind of shunning the white coat nowadays for several reasons. But it's just really important visually. If you're doing a TV interview or a video like this for social media's sake, people need to be able to immediately look and know that this is a credible source. And one of the best ways to do that is to wear the white coat, to wear the stethoscope. So I think the visuals here were really important. And then secondly, her description of antibiotic resistance was great. I think from a simple standpoint, I mean, this is an issue that you can go down the rabbit hole pretty quickly, especially when you're relating it to agriculture. So there's so many dots to connect, but I think she did it pretty seamlessly in how she described, first off, just how bacteria are resistant to antibiotics, what happens, and then the situation on farms and how that is, playing a major role in driving the spread of antibiotic-resistant bacteria. So that's just one quick example of what I consider a pretty effective interview. So the last thing that I want to touch on, and we'll give folks on the webinar an action item to come away with, is opinion media. So opinion media, what I mean by this is things like opinion editorials or letters to the editor. Typically this is for newspapers. One fun fact is that the opinion section of a newspaper is still the second most widely read part of a newspaper behind the front page, which I think is pretty incredible. So this is a place where you can really get your message out there. The communicating to decision makers piece is especially important. I think I've had the experience of elected officials seeing opinion pieces that we've put out there and then reaching out to us to hear more about what we're doing. So elected officials definitely pay attention to what their constituents are saying, and that happens in the opinion section of a newspaper. And then I think one of the best parts about opinion media is you have full control of your message. So you are writing the opinion editorial or the letter to the editor, and so you can control that message throughout the entire thing. So really quick difference, opinion editorials, for people who aren't familiar, these are longer pieces, usually between 550 to 650 words. This is your chance to include a bit more of the substance of the issue and really tell a full, compelling story about the problem and the solution and what you're pushing for. Letters to the editor are much shorter, so usually it's about 200 words. The New York Times is 150 words. So this is an area where you definitely want to keep it simple. I think Mark Twain was the person who had said, I would have written you a shorter letter, but I didn't have enough time. That is totally true for letters to the editor. It is, in a lot of ways, much harder to write shorter, and it takes some time and practice. So letters to the editor, the other difference here from op-eds is that typically it's in response to an article that's run in a newspaper. So, if you see an article come out about antibiotic resistance or about, e-cigarette use among young people, you can immediately write a letter to the editor, take an hour, write 250 words or 200 words, depending on the word limit for the paper, and send that in. And also a really effective way to get your message out there and be part of the dialogue with what's happening in the media. So I want to dive in the last 5 minutes here with just a how-to on letters to the editor. So number one, you want to get to know the procedures for your local paper. I think every paper is a little bit different with how they get letters to the editor. Most of the time it's just a general email that you send it to, but always look on the website, call the editor of the paper if you're not sure what the procedure is. It also usually varies on word count. So like I said, the New York Times is 150 words. I've seen local papers that have much higher word counts, like 300 words. Even if it is a higher word count, I would recommend always keeping your letter around 200 words just to be really short and sweet. And then the quick how-to for writing the letter. So again, refer to a recent article. Typically, you want to refer to one that's been printed in the last week. Anything beyond that is just not going to get printed. You want to make one clear point and then carry that throughout the rest of the letter. I mean, you don't have a lot of space, so really one clear point is all you have space for. And then this is your chance to convey outrage, right? So letters to the editor, you can be a little bit more emotional in them than you would be in an op-ed, but you still want to stick to the facts, right? Do not be hyperbolic. You want to still stick to the facts. And this is also a chance for you to convey your personal experience. Again, as a health professional, I think you have really effective personal stories to tell, and so you can use letters to the editor to do that. And then the last principle here is short letters get printed, clever letters get read. So I'm going to give an example, really quickly for the outline here for people. So an outline of a good letter, number one, you want to state the problem and the topic, why you're concerned. Secondly, describe the problem in a way that folks will understand it immediately. So, for example, when I talk about antibiotic resistance, the way I talk about it in a way readers will immediately understand is that, could you imagine going to the doctor with what you think of as a run-of-the-mill infection, and it turns out that that infection is not readily treatable with available antibiotics. That's a situation that people can potentially relate to. And then stating your solution both generally and specifically, wrapping it up with the final why, I think is one of the most important pieces. You want this to be like a punch to the gut, right? So wrapping it up with the final, here's why we should be doing this. I always like to end a letter to the editor with a call to action, whether it's passing a specific bill that's pending in the State House or nationally, or calling on people to do something specifically themselves. Always good to end with the final why and an action. And then send it in, and don't be afraid to call the editor. So I always send my letters in, I wait a day, and then the next day, if I haven't heard back, I call the opinion editor of the newspaper, and I make sure that they received it, and I give a quick pitch for why my perspective is an important thing they should be printing in regards to the article. So the last thing I want to do is just walk through an example. So this is a letter to the editor that I had in the Washington Post earlier this year. The article I was responding to was about how the FDA had just put out new information that said medically important antibiotic sales to the meat industry had declined. And, the article was pretty favorable to the FDA, and I think rightly so. It was a good step forward, but I wanted to make clear that this was not nearly enough, right? We still had a long ways to go to reduce antibiotic use on farms and protect these drugs, and so I wrote this letter to do that. So I'm just going to quickly read this out loud, and that's another good tip for advocacy writing and media writing. Always read your stuff out loud. That's one of the best ways you can make sure that it's simple, that it's effective. If you find yourself running out of breath at the end of your sentence, probably you should shorten that. Or if you're talking and it sounds weird or awkward or kind of garbled, then again, you should probably simplify it. So, as mentioned in the January 2nd editorial, Saving the Miracle Drugs, new regulations on consumer demand led to a decrease in sales of medically important antibiotics to the meat industry. That's good news, but we need to keep pushing for progress because our ability to treat life-threatening infections is at stake. So again, the first part, when we look at the outline, stating the problem and the topic, why I'm concerned, and a way people will understand it. Our ability to treat life-saving infections or life-threatening infections is at stake. The next paragraph, that 5 years ago, my wife came down with staph, a type of bacteria that can cause severe skin infections. The doctor promptly prescribed a rigorous course of antibiotics. Her story had a happy ending, but each year thousands of Americans aren't so lucky. Again, that was my personal connection to the issue in the letter. And then although sales of medically important antibiotics for use in food-producing animals dropped 33% between 2016 and 2017, we still vastly overuse these medicines to produce meat. And we're not going to read the rest of this paragraph. Basically, it just goes through why producers misuse the drugs and why the needle is moving a little bit forward. And I want to focus on this last piece here. So these were the last two paragraphs. The Food and Drug Administration should limit the use of medically important antibiotics to treat sick animals or to control a verified disease outbreak. So that's my call to action, right? I'm calling on the FDA to do something specific. And then the last line, the final why, life before antibiotics was much more dangerous. we can't go back, right? That's the punch to the gut, and that's a really important piece of your letter that you want to focus on. And that was the whole thing. So that is the end here of our webinar. I think if folks want to take a stab at writing a letter to the editor to your hometown paper, you should totally do it. It's a great way to be part of the dialogue. I'm happy to proofread these if you want me to. You can email me with your letter for feedback or just any other questions you have at mwellington@pirg.org. And I think we have a little bit of time for questions, so I'll stop there.
Thank you, Matt. So if folks have questions, like I said, there's a chat box feature on the footer of the webinar platform. If you click there, I can facilitate the Q&A. And while folks are doing that, there was a lot that I took away from this because MPHA gets asked to weigh in on different topics. And I think the one question, I have a few questions, but one of the questions I have for you is, so if someone, in research, whenever we write up our results, we're always talking about the limitations and things we could have done better next time, and we want to offer caveats to our findings. I liked your point about distilling the information down to keep it simple and straightforward, but if someone's more inclined toward the several caveats and, acknowledging limitations, do you have any suggestions for how to be able to do that, either when talking to the media or when talking with legislators or, the general public?
Right. Well, I think probably the best, what I would do is have your sound bites that talk about the key findings of the report and just be conscious of the fact that that's the message you want to be putting out there to reporters. But if reporters or legislators or somebody wants to dig in and actually, read through the caveats and limitations and what you just said, be prepared to have that as well. I don't know what the typical layout would be, but like a one-pager that talks about the limitations and the caveats, but still leads with the top-line messages would be important, I think, for a research paper. And that's actually probably something reporters would really appreciate if it's a long, research paper. And a lot of these reporters, they don't have medical backgrounds. And so anything you can give them to distill it down, they will appreciate. So I think one thing I would do if we have it, and we did it for the chain reaction report, even though it's not a really dense report, we had a one-pager that had our sound bites, and then underneath that we had a very short summary of the methodology for what we used to grade the restaurants.
Great. Yeah, I just think, there's so many parts of public health when we're thinking in systems and how all these systems interact to result in really anything that we're talking about, whether it's the use of e-cigarettes or obesity prevalence in different neighborhoods. And so trying to figure out how to condense all that into a simple message, I think, can be challenging. And I think your point, again, about distilling it down and keeping it simple is well taken. Do you know of anything like a Toastmasters or some type of a training where people can practice with each other on distilling their message down? I know you're based in Maine, so I didn't know if you knew any opportunities like that for folks.
I don't know of anything off the top of my head in Maine, but I think just it doesn't have to be super structured. I think as long as you just take even 15 minutes and pretend, this is what I do when I'm about to go on to a TV interview or anything like that. I just take one of my colleagues aside for 15 minutes, and I think through, what are the basic questions this reporter is going to ask me? And usually it's just, what is this about? What's your main message? What else do you want to share? And then I take those 15 minutes and I just practice. I do one round of practicing my answers, and then afterwards I think through it a bit more, and then I distill it down even more and do another round. And I think that's good enough for folks usually to be able to just get used to it. I think one of the things that happens is a reporter will ask you, do you have anything else to share? And all too often people say no, but actually that is the opportunity for you to reemphasize your main message. So that's one of the most important things that folks can practice in those settings, and just be ready for it, because it's almost always a question reporters ask right at the end of interviews is, do you have anything else you want to share? And my advice would be practice that piece constantly before you actually do the interview, and be able to put it out there in 2 or 3 sentences, because that's, what will, usually that's what they'll latch onto in print.
That's great. That's a really good idea, I think, about the practicing as well with your colleagues. Any other questions from folks that are on the webinar? All right, well, if you think of any, Matt has provided his email address here, and I think all of you have mine. I sent an email out this morning, so you'll have gotten it there. So feel free to get in touch with us. Matt, I want to thank you very much again for taking the time to talk with us. This was an excellent webinar. I learned a lot. I'm in this position quite a bit for MPHA, and so this was very helpful. You had a lot of great information here, so thank you very much.
Of course, yeah, thanks for having me.
And just to let folks know, we're going to start up a more regular webinar series starting in January, so keep an eye out. We'll be sending an email out to folks with the schedule then. So I hope you all have a nice weekend, and thanks again for joining.